So this is session 1, the first time I've seen Harish, and this is part of the neurological testing. Now he's had right L5-S1 prolapse with disc degeneration. So when we raise the leg, let me know, Harish, when this is painful. Yes, is it painful there? So we can see at this degree it's painful, so we're going to drop the leg. When does the pain ease?
Less.
Okay. Okay. Now we see at around 15 degrees, as you can see on the video. This is when there's no pain into the buttock area and there's no pain radiating down the leg. But as I bend the foot, we see the pain is now going down. Okay. Okay. And then we release. So we now know at around 15 degrees it's positive. So we lower the leg. Good. Now what I'm about to show you is after just one session of treatment, bearing in mind Harish has been like this for 6 months, after just one session what the difference can be.
I can't sleep in the night time. I just 6 weeks, very tired, fed up.
Okay.
And I can't properly walking.
Okay.
I'm sorry, I can't properly speak. If you understand English. Yeah.
This is what we're going to change this. We're going to change this. Now with Harish, the first part of treatment is going to be to release the deep hip muscle and to release some of the nerve and to diminish the pain. We're going to use that with acupuncture. Now from the MRI scans we know of what level the damage is, so that helps us quite a bit. But the palpatory skills are good enough to be able to know the areas to work on. Yeah, look at it.
Yeah, little bit.
Yeah, જાય છે? પણ નીચે જાય છે?
પેન નીચે જાય છે?
હવે જાય છે.
Okay. So like what you've seen in the other videos and what you see with Harish is we're adjusting the joints. By doing this, the pain is radiating down the leg and it's replicating the pain that Harish came in with. We have to pay careful attention to the location we're at, so we're just not causing muscular pain, we're actually adjusting the joint. We have to also pay heed to how far we're pressing, how intensely we're pressing, and the vector of force we're applying. And we bear all that in mind with the time. Now there are many ways to adjust the joints. With this one we're going to gap out the side of the back to free space up for the nerve. So this is typically called foraminal gapping. I'm going to take this leg to your chest. Now, what I want you to do, Uncle, I want you to push your leg out. Yes. As hard as you can, but keep breathing. Go. 5, 4, 3, 2, 1. Relax. Let it go, let it go. Breathe for me. Good. And again, push. As hard as you can. We're going to stand from here and we're going to adjust the hip. Good, you're doing well. Perfect. And now we're going to cross this one over here. We're going to take this. Can you put your hands behind your neck? Good. You're going to turn you over this way. Relax there. Bit of a funny one. Make it into a banana. I'm going to press down into this hip. So bring your hands up. Relax. Good. Hold there, Uncle. Take a deep breath in. And breathe out and relax. Breathe.
શ્વાસ લો. કાઢો કે શ્વાસ લો?
શ્વાસ લેવો ને કાઢો, રોકી નહીં રાખતા.
Good. And again, Uncle?
પાછું.
Good. Yes. Okay. Now come and have a look at this, Auntie. And we've adjusted the hip. We've leveled Harish ankle out. Now do you see the difference?
Yes.
They're equal.
Completely easy.
Yes. So we can notice the difference. Harish came with one leg apparently longer than the other because of the hip. We moved the hip back and the legs are now equal, and that'll have huge implications for his nerve and for the muscle into the hip and for the pain in general. Now what we're going to do again is after that we're going to do the straight leg raise again as an orthopedic test. Alyssa Taichenko. Yes, now we can see how we can get to nearly 45 degrees and then the pain starts to come on. Perfect. So now we've got almost 3 times an increase in the length in the arc angle. Okay. It'll take a few more sessions to get to you, but we can change you.
Yeah.
We've made a vast improvement already in the first session from being here, as you originally were in the beginning of the video, to being here. Yes? Okay. As treatment goes on, we'll be able to raise your leg further and you'll have less pain going down your leg.